Welcome back to SG Dr. Wellness, and in this two-part video, I'll be sharing about asthma. Increasingly, I'm seeing more and more young children with asthma, and they may not necessarily present with the classical wheezing. So what is asthma? It's actually a long-term inflammatory airway disorder that results in airway tightening, causing difficulty in breathing, and this produces the characteristic wheezing sound during asthma attacks. It also produces excessive amount of mucus, which makes it even harder for the patient to breathe, resulting in persistent cough. Please remember that asthma is a long-term ongoing issue with periods of good quiescent times interrupted with periods of attacks. And the goal of treatment is to minimize the number of attacks and hopefully reduce it to zero. It doesn't stop at just one episode. So who gets asthma? Are you able to recognize the signs and symptoms of asthma? What are the triggers of an asthmatic attack? If you're suffering from asthma or if you have children that has asthma, watch till the end to understand more about it. So which type of patients have higher chance of getting asthma? Those with a positive family history of asthma. If you have a parent who has asthma, you are 3 to 6 times more likely to develop asthma. Allergic conditions. If you have allergic conditions like eczema or allergic rhinitis or allergic conjunctivitis, then your chance of getting asthma also increases. Smoking. Smokers have a higher risk of asthma. 4. Occupational exposures. And there are certain types of asthma which may be caused and triggered by occupational exposures like industrial or wood dust, chemical fumes, and vapors. Symptoms of asthma varies from person to person, and they may include persistent cough that is prolonged, wheezing, shortness of breath, chest tightness, excessive mucus production. And characteristically, these symptoms run a prolonged course which may be months to years. And typically, symptoms are more pronounced at night or in the early morning. We describe this as the dusk and dawn phenomenon. Patients can be perfectly normal when asthma is quiet, but they will suffer attack and they may be very uncomfortable. Young children can also suffer from asthma, and in fact, it is even harder to get an actual diagnosis of asthma in young patients because they are often unable to go through diagnostic tests called spirometry. Therefore, if your child has persistent symptoms that I have mentioned above, please see your nearest family physician or pediatrician for a clinical review and diagnosis for prompt and early treatment. Asthma is diagnosed by your doctor using a combination of characteristic history findings, characteristic findings on physical examinations, objective tests which may include a chest x-ray and a lung function test. Thank you for watching this till the end of the video. In the second video of this asthma series, I'll be sharing more about the triggers of asthma attack, the treatment of it, and the top 8 tips to prevent asthma attacks. Subscribe, like and share this video if you found it useful. See you next week for part 2 of asthma series.